Welcome to the Purposeful MD podcast. As a physician, you've sacrificed so much of your life for other people, your patients, your family, your friends, and your colleagues. What would it feel like to spend time doing what you enjoy and to live without guilt? I'm your host, Dr. Laura Sutton, a family physician, certified coach, and business owner. If you're a medical professional on a journey towards your most purposeful life, a life with more time and energy, and ultimately more joy, then this is the podcast for you. While I am a physician, the information presented in this podcast is for educational purposes only and should not be considered medical advice. It is not a substitute for professional medical advice, diagnosis, or treatment. Please consult with your own healthcare provider before making any significant changes to your lifestyle or routine. By listening to this podcast, you are not creating a physician-patient relationship. Welcome to the Purposeful MD podcast. I'm really excited to have our guest today. Her name is Dr. Mrinalini Kulkarni-Date. Thank you. And I'll introduce her in just a second. Wonderful individual that I met at PIMDCon last September. And we got to chatting about some similar interests, and I'm really inspired by what she does. So really excited to talk to her today. So Dr. Kulkarni-Date is an associate professor and division chief of endocrinology in Austin, Texas, and has served in multiple leadership positions. She's been recognized for her work in faculty and physician development in the medical school and national recognition as well, winning multiple teaching awards. She's a career coach and mentor for women physicians seeking to develop thriving careers in academia and health system leadership. She currently serves on the Travis County Medical Society Committee for Women in Medicine. Thank you so much for being here. It's great to have you.
Thanks for having me.
Yeah. So we were chatting a little bit before we hit record. I'm super excited to dive into this with you and just again connected with you at PIMDCon. Really felt like you're in Austin, I'm in San Antonio, so we have that in common, but also very kind of similar minded. So really wanted to connect with you afterwards. So appreciate you being here. Tell us a little bit about your journey and how you got to where you are right now.
Sure. So my journey is kind of long. I mean, I've been at it for a while. I finished fellowship. I'm an endocrinologist. I finished fellowship. I joined an academic institution initially that had kind of a private practice model, and just, started noticing some things. I mean, I loved seeing my patients, but I also was interested, like, I was always thinking about how can I make clinic better? There's some things we need to do. We need to have some initiatives. I also had some fellows in clinic, love teaching. It's one of my absolute passions. And so as I started sort of getting involved in clinic processes and procedures, I was sort of recognized by that leadership of my, that I had this interest. And eventually I started, I started then, I moved into some clinic leadership, and then I did some clinic development. Then I sort of shifted some roles in academia. I did some curriculum development. I had a role as institute director where I actually like developed clinics, clinical interventions that were really sort of outside of the box, not just a concrete clinic where you're seeing patients in a traditional way, but leveraging telehealth, leveraging home visits. Really had to take care of some challenge. I was asked to take care of some vulnerable populations. And so in doing that, I sort of over time found my way into this. Well, I was at this position for a long, long time. And then when I became chief of endocrinology at this academic institution that also had a big clinical enterprise. And I actually that was the first time I got a coach. And that coach, I found myself in the C-suite. And I was amazed to find a couple things. One is I felt like the environment of the C-suite was it was so traditional. It was this good old boys club, and there were things that you learn about how to be and how how we are. And I was one of the only women there. And one of the things I experienced is when I had my first when I was with my first pregnancy, when I went on leave, there's this idea that like women physicians who go on leave for maternity leave, just like we're creating problems within the system, and we're really not serious about being doctors, and we're really not serious about our commitment to the institution or patients. And that's just not true. And then the other thing I found is when I came back, there was this like my chair was like, oh, you owe us all this time. So you should take all this extra call. And I was like, no, that's not it. And I also noticed this paradigm of like women who were taking leave for maternity leave and like maybe take days off because if you get called and your kid's got a fever, you got to go pick them up. We're like, oh, you're really not committed. But men who did that were, oh, you're so great. And it's so great that you're committed to your family. So, I started noticing those paradigms as I was, as my career was on this career trajectory. And then when I was in the C-suite, I noticed these, some more stuff like, it was mostly men who did all the talking in the rooms, and the people who were being promoted were men, even though like you saw women doing the hard work of getting things done and figuring out these programs and doing the hard analytic work. And so I also realized there was this big we versus them kind of mentality in medicine, right? It's like admin versus the clinic people who, are very work avoidant and don't want to work. And but a lot of even the physicians in admin kind of like they have this reputation of going to the dark side. So I just saw so many things, and I really I got a coach, and that was really transformative for me because I learned how to have great conversations. How do you structure those conversations? How do you start off, if you complain or you vent or you start off on a certain note, you don't get your message heard, number one. You have to come off collaborative, number two, right? There is this sort of divide, but how do we come cross that divide, and how do we show people how committed physicians are? And anyway, so I sort of progressed through this career, and I became medical director of virtual care, institute director of the brand new clinic, and had some really great experiences and worked with some really amazing people. But one thing that I just like, and the other disturbing thing that I noticed is, people are leaving medicine. And I feel very sad about that because number one, I think medicine can be a wonderful career. Number two, there is such a need for physicians out there, and we give great care and we are really caring. We care about patients. And so I always feel about, there's so many patients there that are never going to see these certain physicians who are leaving. So that's something that has really, really disturbed me. And that, along with, we need to lift women up. Women, they're only like, if you look at how many women are in leadership positions, it's getting better. But like, if you look at med school deans, for example, probably, well, nationwide, only about 10% of women are deans in leadership positions in in medical schools. Maybe a little bit the same, maybe slightly better in healthcare institutions. But we've got to get more women in leadership. We know that patients love women physicians, right? They say, "Women talk to me." My women physicians, they listen to me. They understand how I feel. They understand the family dynamic, and we're just as good in leadership. And so I just have a real passion for it. So I now I do a lot of mentoring. I do a lot of coaching, consulting. Really want to advance women in leadership and women careers, whatever that might be.
I could not cheer for that harder. And just thank you for sharing all that. And so much of your story, I feel like some of the details, obviously changed our institution, but I feel like that story was so similar to mine. The maternity leave thing, it boggles my mind still. And I feel like we could spend the whole podcast talking just about this, but so my daughter, I have one of my own and several, three older stepkids, but my daughter was born when I was in residency. I was very lucky to have a very supportive team around me. Um, and I also saw when I finished and got into my career, I saw women that were having children and the kind of the talk behind their back about, well, it's just a vacation and she's taking 12 weeks off and she's going to have to make up for it when she comes back and all of this. And it's just,
Yeah,
it's
yeah,
mind-boggling to me.
right.
And
Or even like use your PTO. And I'm like, no,
right.
you need that
Yeah,
PTO because when your kid gets sick, you need to
right.
use that time.
Right, right, because that child will get
Mhm.
sick. And then I was also very similar. I was navigating at the time I was a lot of the time in my leadership career, I was a single parent before I got remarried. My daughter was small and um again my very supportive co-parent and her father, we split custody, and when she was with me, if she got sick, and a lot of times even if she was with him, the school would call, they who do they call the mom first, right?
Yep.
So the times that I would go pick her up, I have to leave work early to pick her up, like I know I was getting kind of snide comments because I heard them when all those situations happened with my women colleagues. And I saw the promotions going to the men who a lot of times had stay-at-home wives. So if the water heater broke, they had somebody that could be there to, have the plumber come in. I didn't have that situation. Um, and I also saw we had a leadership team at one point that the meetings were always late in the afternoon, and our organization spanned multiple time zones. So there was one leader in a time zone that this meeting happened to fall later in the day. She had to be picking up her kids at the same time this meeting was going on. So she could never be on camera. She was always in the car. Sometimes she had her kids with her. And the comments about her when she was on, when like before the call started or afterwards, like it was horrible. The things that were said
Yeah.
about, like, oh, she's picking up her kids. She's not really focused. And it's like, but it's 6 p.m. out where she is, she's got to pick up. It's just, it's such
Yeah.
a, again, I'm no, I'm preaching to the choir, but it's just
Yeah.
such a double standard
It
against
is a
women
double
having
standard.
girls.
Or
Yeah.
I used to have this meeting that was like, I don't know, it was at 7 a.m. And I was like, I have two kids. They go to different schools. My husband and I split up the drop off. And there's no place that I can drop them off that early in the morning. And
Right.
honestly, they shouldn't have to.
Right.
So I didn't always go to that meeting. This was before the days that Zoom was so available.
Hmm.
I actually like my chair then told me, my boss told me that, well, the person who runs this meeting doesn't think you're a very good collaborator. You're difficult to work with. And I was like, based on what? I have done all the like I had maintained, I'd gotten all my deliverables done and more and was otherwise always available. Which we shouldn't have to be, but that's another story.
Right.
But it was that one thing that made me difficult to work with.
Yeah.
And there's data about this. Oh, and by the
Yeah.
way, there's also data about even between men and women physicians, like are studies there is a study that has shown that the inboxes for women physicians, like the inbox is like this evil, horrible thing, right?
Mhm.
It's like totally overwhelming. We get more messages, longer messages, and we have to spend more time answering the inbox than male physicians do.
Yeah.
And I've witnessed like the male physicians are saying, hey, why are you guys complaining so much? Like, yeah, the inbox is the inbox, but when you look at how many messages they get versus you get a lot more.
Yeah.
And again, I think it goes back to that other paper that there's another paper that showed that people prefer women physicians because they
Hmm.
feel like they listen. So
Yeah.
anyway, but
Yeah. Yeah. So interesting. So interesting. And I think I love that so much about where you're focusing your energy now is in mentoring other women so that women are staying in medicine, staying in academia, and not kind of seeing the current state and sort of a lot of what we went through and hopefully is getting better. But really encouraging women physicians to just kind of stay in it and helping to guide them along the way, which is the coaching that you got, is how to get your message across. And I know we talked about that a little bit too. I definitely want to dive in how to get your message across in a way that um, we're not talking about mansplaining or anything like that, but how to
Right.
get, we don't get this training in medical school and in residency. We don't get training with how to act in a meeting or how to make sure your voice is heard. And so, yeah, so let's talk a little bit about that. Let's talk a little bit about, before we hit record, we were talking about kind of creating that tweet. So I definitely want to hear from you
Ah,
about that. And yeah, just how do we continue to get our voices heard?
okay. So I use the tweet. I call it, how do you, I call it creating your tweet. I use this not only, so I certainly mentor people in academia, but I have clients who are in private practice and, they work for whatever, Kaiser or whatever. And they're in leadership positions or they're trying to get, the leadership positions. Or maybe they have some passion project, in that private practice world that they really want to get going. So if you're thinking about something you want to do, so it could be as simple as I'm a clinician, I'm in clinic, which isn't simple, but I'm in clinic and I'd really like us to hire a nurse because we have a need for, to give infusions or have the patients need nurse visits for diabetes, right? So how are you going to, so you could complain, right? You could say like, oh, I'm so overwhelmed. These patients aren't getting good visits. They're just getting less follow-up and I'm overwhelmed and there's just so many messages and I don't have enough help. But you're going to be, and so you have to think about number one, who needs to hear your message? You have to think about what is that message? Nobody wants to hear complaining, right? It just, we all tend to turn that off.
Hmm.
Um, so it's not a vent, it's about so knowing who you are, like, so maybe I'm meeting the CMO, right? Or the medical director, and they don't know who I am or don't know me very well. So I want to create a succinct message, and I call it a tweet. So it's like a 20-second message. Some maybe you have 30 seconds, but maybe it's a 15 to 20-second message where you say who you are, what you do, and you say, I am one of the busiest endocrinologists in the diabetes clinic, and I have X number of diabetes patients, and I have noticed that we're not able to do X, Y, Z, and the data shows that we'll have better health outcomes or we'll meet our metrics. We're more likely to meet our metrics if we can create some nursing visits to help patients stay adherent to medications, adjust their insulin. So you have like who you are, what your main point is, what you're doing, if you have outcomes, what those outcomes are, and you have like points 1, 2, 3. And those aren't complaining points. Those are here's who I am. Here's what I have identified, and I'm so excited to try and solve this issue. And here are my ideas about solving this issue. That's your second or third point, and you're done. You've gotten that person's ear, you've got 20 seconds, and you have a very succinct message. So I actually have people that I work with practice this message.
Yeah.
So we'll identify like what are the things that you are really trying to work on or you want to do, and let's create your tweet. I have a client that I'm working with right now she's really amazing, but she's working on creating some mentorship programs in entrepreneurship for women. And she specifically wants to do it for women who are divorced and socioeconomically disadvantaged, or single moms who are socioeconomically disadvantaged. And so she's trying to get some funding. And so we helped her create tweets based on like who are the potential investors that she's looking to, and she only has a few minutes with them. What is she saying?
Yeah.
And that can be a really effective way for you to succinctly say what your purpose is, and people actually listen.
Hmm.
So that is the creating your tweet, and I create many tweets for many different things. Um, and I think it's a great tool. It's a really great
Yeah.
tool.
Yeah. I love that. That's something that when I was really crafting my business and honing my business, that was something that I was encouraged to do as well as part of a community. It was like the elevator pitch, basically.
Yes, it
When
is
somebody,
exactly that.
because somebody, and this was a big kind of transition for me as I was moving more from practicing physician, corporate executive to physician coach, business owner, entrepreneur. And people say, "What do you do?" How do I answer that question? And so that was a big identity shift for me, but really honing that this is what I do and this is who I help, this is who I serve.
Yeah.
And I really appreciate that you're helping those physicians to really take that ownership back. And like you say, the CMO is not the person to complain to. I'll never forget when I was in medical school. I must have been a third year, very beginning of my clinical rotations, and I quickly realized there was this hierarchy of who you ask, what person you ask for things. So I remember somebody telling me like, don't ever ask your attending where you get scrubs. You know, ask the fourth years or ask the interns where you get scrubs, but don't ever ask the attending where you get scrubs. And I don't necessarily need to reinforce the maybe overdrawn hierarchy, but there, like you said before we hit record, if you pass the CMO in the hallway or if you're on the elevator with them, you have a great opportunity. Hey, this is who
Yes.
I am. This is what I do. I have this great idea, and this is how it could help the organization, help the service line, help the department, whatever. Um, can I schedule a meeting with you, or whatever that looks like?
Yes.
Would you like to hear
Right.
more?
Or
Yeah,
it might even be, is it all right if I send you a follow-up email, right?
yeah,
And you schedule a meeting that way.
yeah.
Um, I've actually, we've actually, by doing that, I have seen people like the dean say, "Hey, I want you to come and, join me in this effort," or "I'd like you to apply for this position." Because what you're telling me about is an issue for many places.
Hmm.
Help us, you know, maybe you can, there's a position that I'm looking to create to address these issues.
Hmm.
So yeah, but taking like being able to seize that moment,
Hmm.
because if you end up in the elevator with the CMO and you're like, hi, right? Like that's
Yeah,
an opportunity. And you
yeah,
don't.
yeah, yeah. I think that's great. I think that's great. Tell us about some of the other things one of the other things that you want to talk about was the delicate dance of saying yes. And
Yes.
I want to dive into that because, yeah, tell me more about what you mean about that.
Okay. So, nowadays we're talking a lot about boundaries, about work-life balance. Um, and that's so, so important, right? And when you are creating boundaries and work-life balance, we say, well, you should say no. You should say, no, I'm not going to do this. I'm not going to take on this project. I'm not going to see these extra patients, whatever. And you should say no, but there are a couple of keys to saying no, especially when you're talking about career development. Even if you're like, you know what, I don't want to move up into my organization, or I really like doing what I do. But even being a functional collaborative member of a clinic of your or hospital group, um, you especially when you start your career, you're going to say yes to more things initially,
Hmm.
right? And you're going to say yes to more things initially for a couple of reasons. Number one, you might be wanting to expand some interests into other things. So saying yes to this committee or this project gives you more experience. Maybe they're looking to do a quality improvement initiative in your institution, in your hospital or your clinic. You might say yes to that. You're going to learn about QI if you don't already have that experience. It makes you more visible to other people in the institution, right? And you're new and you're like, do I like this? I don't know. Maybe this is something I want to do. So those are reasons to say yes particularly in the beginning, because you're trying out different things, finding what your passion is. And number two, the impression you make in particularly at the earlier in your career is really important, right? People end up looking at, like, just as we talked about, oh, the woman who goes out on maternity leave. But if you say no to things all the time, then people will sort of think like, oh, Mrinalini's not really interested in this. She's, got a lot of stuff going on, and so we're not going to ask. I'm not even going to ask about this other opportunity that's coming up or this other project that's coming up. So you put yourself at risk for kind of being labeled as, somebody who's just kind of wanting to stay in this one space.
Hmm.
And if that's what you want to do, that's okay. But that potentially might limit you from exploring other possibilities
Hmm.
and how you come across to your institution.
Hmm.
So in the beginning, you're definitely going to say more yes. The third reason to say yes, if you're, and this is despite whether you're early career or not, is you want to say yes to things that you are A, interested in, B, you think carefully about. Is this, you want to think about your career trajectory. So maybe I know that I do want to get into the administrative side of medicine. I want to become a medical director. I want to become a chief medical officer, or I want to have more say in how my private practice is running,
Hmm.
right? Then if I want that, then I want to say yes to the things that are going to help me get visibility or actually relate directly to what I want to do. So
Hmm.
those are things. And so one of the questions you ask yourself, is this going to help? Does this serve me? Does this serve my career? Or does this serve this cause that I'm very passionate about? Maybe I'm really into advocacy for children. So those are the guidelines for yes. When do you say no?
Hmm.
You say no to things that you're like, I've already got 5 committees. I really don't need this committee that they're asking me to do. It doesn't help my career trajectory. I really don't have the bandwidth for it. Or maybe it's something I do want to do, but then I need to switch something else out. I'm going to stop this other committee and do this committee.
Hmm.
Maybe so. For example, I deal this a lot. I deal with this a lot in some of the academic clients I have. If your goal is to get promoted from assistant to associate, and we know that to do that, you've got to publish X number of papers or serve on this number of committees, we want to say yes to those things that help that. And we want to politely say no, not at this time, to those other things.
Hmm.
And what happens if your direct boss says, "Hey, Laura, I'd really like you to sit on this interviewing committee for
Hmm.
this new doctor that we're bringing in." And you're like, "Oh, I have so much on my plate." How do you craft that conversation? That conversation might be, "Thank you so much. I really am so excited. It's wonderful that you thought of me, and I'm really flattered. But as you and I talked at my evaluation meeting, our annual evaluation meeting, in order for me to get promoted, for me to work towards my promotion, I need to be working on X, Y, and Z.
Hmm.
And I need to really have that time to work on this paper or work on this committee or
Hmm.
this national committee that is more important for my promotion as opposed to this local effort." And so that way, not only do you say no, but you spin it in a way of, "Hey, we talked about this, and
Hmm.
this is what you told me to do, and this is what I'm doing."
Yeah.
So there are different ways to say no that really don't come across like, "Oh no, I'm not going to do this."
Yeah.
And again, it's about crafting it. It's about really being thoughtful about, what do you say no to? What do you say yes to?
Yeah. I
'Cause
appreciate the way
sometimes,
you
oh,
go
go
ahead.
ahead.
Go ahead.
No,
Oh,
I said sometimes we go overboard and we're just like, nope,
yeah.
I'm trying to I have to keep my space and I'm not going outside of these boundaries. And it can sometimes do that as at a detriment to yourself and
Hmm.
your own progress.
Yeah. Yeah, I appreciate the way that you frame that, and I've spoken a lot about boundaries. I talk about it in my book quite a bit. It's not this, okay, I'm setting boundaries. It means I say no to everything. But and I hope that message didn't come across from my writings either, but it's about, like you said, being intentional. What are the
Mhm.
things that we are going to say yes to? Because when we say yes to something, we're saying no to something else. There's only so much time and energy that we have. And then if we are saying no to something, then what there that creates a vacuum. So what are we saying yes to in its place? And so it's really kind of, how do we fit the rocks in? And I really appreciate what you said about, especially early in the career, if we know we want to become a leader, get promoted, kind of explore different areas. We don't know what you're going to be interested in, and so trying different things. I got interested in a lot of different things, so I tried a lot of different things. And so I did QI, I did physician compensation, I did a lot of physician engagement. I did a lot of different things. But unless you try it, you really don't know, and really don't know what your strengths are going to be. You don't know how you could
Yeah.
contribute. I think I hear that a lot is, well, I don't know anything about this. I remember coaching somebody on a physician on that before, was asked to be on a committee, and she said, "Well, I don't really know anything about it." And I said, "Well, that's kind of how you learn, is
It's a
you
great opportunity to learn.
exactly. Nobody
Yeah.
gets on the committee and knows anything about it. I literally started a committee 10 years ago in my previous organization that I didn't know anything about, but I was
Yeah.
asked to start it and learn about it along the way. So I
And
think
sometimes being the inexperienced person is a good thing because
yes,
if you don't know anything about it, you might be liable to think outside of the box and bring
yes.
some solutions that nobody else would have thought of.
Oh, absolutely. Absolutely. You have the kind of the beginner's mind, and
Yeah.
everybody might be stuck in their own ways. Yeah. Yeah, for sure. I love the way you crafted also how to say no. And I talk about this in the book too, is and my previous boss was actually very protective of my time, and I was lucky that he was always encouraging me to, if I got asked to do something, then okay, I can, but what am I going to be giving up? And he would always help me to really ask myself that question: is if I'm asked to join a new committee or do work on a new initiative, then okay, yes. And what am I going to be, what's going to be put on the back burner? What's something that I'm going to be handing off so that I can make time for that, so that I didn't get overwhelmed. And so that's something that I did get really good at, is saying no in a way that that still honors the request, but also really serves my own needs. Um, I think, and you've probably seen this too, is that the hard workers are the ones that are going to get asked, right? If you need something done, you ask a busy person, right?
Yeah.
And so the ones that are already killing it in other parts of the organization are going to be the ones that are asked to do more work. Um, and so sometimes there is an opportunity to say, I thank you for considering me. I've already got these other things on my plate and I wouldn't be able to do it justice. Maybe this other person can, or um, you don't have to suggest somebody, but sometimes there might be somebody else you can think of. So yeah,
Or
I
even think of other ways that you could help. Maybe when you get to this
right.
stage, if you need any input in this particular area, I'm happy to
Yes.
to meet at that time, right? So you're not totally saying no. And
Yeah.
again, you shouldn't do it out of compulsion, like, oh my God, I can't say no. But there's just different ways to do it.
Yeah. Yeah. I love that. And then the other thing that you mentioned that you wanted to talk about, and I love this too, is creating your network. And then as we were chatting about it before we hit record, the word that came to mind for me is the village.
Yeah,
Who are the women that you work with? Who do our colleagues? Who do we go to for support? Who do we
yeah.
network with? And who do we surround ourselves with?
So, so I have to say that I'm actually a very, like, in some ways, I'm a very social person. And when I first started my clinic, when I got out of fellowship and I was in the clinic, like I was in the clinic, I don't know, 9.5 days or something. I love seeing my patients. I love talking to the staff, but I would get really I would feel boxed in. I'd get really
Hmm.
sort of like lonely. I craved talking to people. And then when I came home, my husband was like, man, you have a lot to say. And I'm like, I mean, I've been talking to my patients, but I really haven't been talking to anybody else. And I really felt that. So but as I've kind of advanced in my career, I'm like, oh, like when you think of networking, I think of like, oh my God, I used to think of like, oh my God, I have to like put on this face and go talk to people and kind of schmooze. And I hate that, right? It's not comfortable. So I think of network as a village or your community, right?
Hmm.
And it's not only like, so I think about if I'm trying to so I'll think about it and I kind of divide it. I have like sort of this career side of it, right? And there are some overlaps. So I think of it as a circle. So on the right side, on one side, I said right side, but on one side, I have sort of my professional community, right?
Hmm.
Who am I going to in terms of, hey, in terms of my professional development? Who is my intellectual community about, well, these new endocrine guidelines that came out? Um, who are my safe space? Like,
Hmm.
I have friends in my work community that are my safe space where I can say, I'm feeling uncomfortable about this, or I'm struggling with this, that I know I can confide in. And you have to really vet these people. but they're, they're kind of like I can confide in and or just like be there. Like
Yeah.
I'm just going through a rough time right now and I just like I need some space. And those, they happen to be women, are amazing women who just like we support each other
Hmm.
in this professional space. So, and they kind of overlap, right? There's a little bit of overlap. You have to be careful with the overlap, but you have to be you have to vet who these people are, but you have to have a community. It's not just one or two or three people. Um, and then I have like, who are the other part of that community is who are my sponsors. So sponsors are people who I like know you really well and identify you in other meetings where they're like, oh, Mrinalini would be really great to start this initiative, or she would really be great for this, the CMO or the medical director. And so who are your sponsors? And if you don't have a sponsor, well, go find sponsors. And that's another conversation altogether. Who are the people that kind of let you know what's going on in your business world outside of your institution? And then and then on the other side of your circle, I have like, who helps me, my community, like, who are my, like, oh my gosh, I'm like, who are my kid people, right? I'm having these frustration with my kids and the whole raising my kids community.
Hmm.
Um, I have that mom network for me has been really powerful. We support each other. We help each other with drop off or pickup. And maybe it's just like, God, my teenager is going through this. What are you guys doing? Right? And they're going through similar experiences or have gone through similar experiences and they help me. I have people that are role models for me. Um, I have just that, so my husband and I together will have our own people who support us and that we network that are in our network together. So it really is, this whole village of people, both professional, not only in terms of this is my job, this is my specialty as an endocrinologist. I'm going to professional meetings and I have, these people that I network with because that's my, my specialty, but also my career trajectory, also, my safe space, my emotional support, my vent
Yeah.
people. I actually have a category where I have vent people. Who do I vent to?
Yeah.
We vent to each other, and it's a totally safe space. I'm like, I don't need any solutions. I just need to be able to vent, and we're able to do that. So I actually have this kind of big spreadsheet that I have my people that I'm working with fill out, and we're like, oh, where do you need more people? You don't have anybody in this
Yeah.
kid group, right? In this parenting group. Let's find more
Right.
people to help you
Yeah.
because it does take a village.
Oh my gosh, it does. You know, talking about studies, all the studies that have been done that show that the quality of our relationships is the biggest predictor of our longevity, and how important that is to our overall well-being. And what you said about going from training into private practice, attending that transition and really, I felt that too. I think I see that a lot of my clients and my colleagues is in medical school and residency, there I think about those times in college too, for me, just the college experience for me. I was on campus for the 4 years, is there's always somebody there that I could go to, whether that's my roommate or my next door neighbor. In medical school, I had my own apartment, but 24 hours a day, there was going to be somebody I knew studying on campus or in a local coffee shop or residency. I mean, there's always people around. And so just that knowing that I could just go sit with a colleague or a friend or somebody or just study across from each other and help make sure that we stay on task,
Yeah.
is so important. And how much of that is lost, especially nowadays. There's not really the doctor's lounge in hospitals, and so I think that's so incredibly important. And having the different categories,
Yeah.
like, so yeah, I've got the vent friends, I've got the mom group friends, I've got the people that I know that are gonna kind of kick my butt a little bit if I'm struggling with something. They'll be like, hey, remember you said you were gonna do this? And
Yes.
then I've got the people like, hey, I'm struggling with this in the business, can you help? Can you connect me with different people? Can you sponsor me, champion me, that type of thing? That's so, so important.
It is really important. And you bring up a really good point about you don't really think about it in college Or even in
Right.
residency, right? You're with all these people, you're in a very intense environment together, and there's this bonding there, and you
Yes.
have a community. But when you're an attending, now you have to be able to maintain a certain persona. Um, and it's harder. And even, I mean, that's really also part of adulthood. You have to just cultivate this network with intention, right? It has
Yes.
to be very intentional and thoughtful in terms of what you do. So it requires a little bit more work, but it
Yeah.
doesn't have to be, really uncomfortable.
Yeah. I know memes about making friends as an adult and just kind of how hard it can be sometimes.
Hard.
And yeah, and a lot of times my daughter's 17 now, she's a senior in high school, but a lot of times when they're little, the people you spend time with are going to be the parents of other small kids because that's who you get together with. And
Yeah.
but some of the people friends that I made when she was little are still some of my closest friends. And so
Yeah, same.
yeah.
Same.
Yeah. And she's got her small group of friends and the moms of those friends. We all have our group chat and we're also, helping each other out when times get tough and we need somebody to lean on and which my daughter thinks is hilarious. She's like, "You guys all have a group chat." And I'm like, "Yeah." And we don't just talk about you guys.
Yeah.
Yeah. So, but we need each other. Um so yeah, I love it. Thank you so much. It's so wonderful to talk to you. Is there anything else that you'd like to share before we close out the podcast today?
Um, well, I just wanted to say thank you so much for having me. The, advancing women, especially in this era of women leaving medicine, is something I'm so passionate about. So I could go on and talk about these things forever, but I appreciate you having me. If any of your listeners are interested in talking, or if anything resonated with them, they can feel free to email me. I think you're going to post my email at the end.
Yes, we'll include your email in the show
Yeah,
notes for sure.
yeah. So
Yeah.
yeah, to speak.
Yes. Thank you so much. So
Thank you.
wonderful to have you.
I really had a lot of fun. This was
Yeah,
fun.
me too.
Okay.
Great. Thanks. Thank you for watching The Purposeful MD on YouTube. If you like what you see, please like and subscribe. Please also visit www.thepurposefulmd.com for free downloads or to discuss working with me as your coach.